Now our clinicians and I will discuss some additional techniques that we use, especially at the core belief level. These are a cognitive continuum, intellectual emotional role plays, and analogies and metaphors. A cognitive continuum is one of those techniques that can help at any level of cognition, particularly when the client is having all or nothing thinking, as clients often do about their core belief. In this technique, the therapist asks the client how much he believes that his old core belief is true. The client usually responds fairly close to 100%. Then the therapist asks the client questions to help him evaluate that idea in order to help weaken that core belief. I've asked Norman and Rob to do a role play to illustrate this.
So I'm going to have Norman role play a client of mine who he has avoidant personality disorder with some OCPD traits. He works in a customer service kind of job, typically gets good ratings from his boss. Every now and then his boss asks him to do a few things differently. He has a few very close friends, but thinks he should have more friends. And he also thinks that some family members don't respect him, even though there's really not much evidence for that.
And his core belief is?
And his core belief is, I'm worthless. Yeah. So that all makes him think he's worthless. And he says, you know, I'm just absolutely, completely worthless. So I'll have Norman just be Norman, or use the name Norman to make it easier. So Norman, we've been talking about this worthless core belief, and it seems like it's a belief that you believe extremely strongly. Is that about right?
Yes, absolutely.
Yeah, so one thing we can try out with this is something called a cognitive continuum to see where from 0 to 100 this falls, and then we can set a few points along the way and see how accurate this is. Does that sound like something you're willing to try?
Yes.
Okay. So starting off, let me draw a line here from 0% worthless to 100% worthless. Yeah. Where, put an X where you think you'd fall on there.
Oh, about 70%.
Okay, so put 70 here.
Yeah.
Now, if you're 70% worthless, how would you describe someone who would be 100% worthless then?
Oh, 100% worthless, unemployed, homeless, no family, no loved ones, just doing nothing.
And, I know you've talked a lot about how you think other people don't like you very much. So would this person who doesn't have family and loved ones, would it be that they're just not trying to pursue those relationships, or would it be that they're not trying to pursue, but even with that, other people just absolutely detest them?
I mean, both. They wouldn't pursue it because people detest them. What's the point? It's like throwing good money after bad. No.
And just looking at this person who would be 100% worthless, so they are unemployed, are they even trying to find work?
What's the point?
No, not trying to find work because there's no point. They're homeless, don't have any family and loved ones. People in general don't like them. If that's 100, do you still see yourself at 70?
Well, if that's 100, maybe 60, 55 so.
Like any of those sound better?
Yeah. Yeah, so maybe I'll go down here.
Okay, so you can mark down where you think you'd be down.
Maybe down about 60 compared to that.
Okay. So I know we talk about your brother a lot because it seems like you guys have a really good relationship, and it really seems like you admire him too. Where would you put your brother on this continuum here?
Okay. At about a 20.
Okay. And what makes you put your brother at a 20 then?
Oh, I mean, that low. He lives with my parents. He doesn't have a job, but he's a nice guy.
Okay. So he's a nice guy. What's that mean?
Well, means he's a nice guy. I mean that, you know.
Okay, so overall he's a nice guy.
Yeah, overall he's a nice guy.
And what I'm looking at too is your description of this 100. So one of the things seemed to be about work. Does your brother have a job?
No.
Okay, so your brother doesn't have a job right now. Another thing seemed to be like being homeless. So your brother's not homeless, right?
No, he's not.
Where does he live?
Lives with my parents.
Okay, so he lives with your parents. He doesn't have his own place then.
No, not yet. No.
Yeah, and it seemed like you said your brother has friends. Is that right?
Yeah, he's a good guy. He's pretty popular. He's, more than I am.
Okay, so he's more popular than you. He has a good amount of friends. And then another part looks like with family. So, like, I know he's living at home now. Does he get along with your parents okay?
They fight occasionally.
Okay, so there's kind of some fighting between him and the parents then. So then if your brother's at a 20 where he doesn't have a job now, he's living with your parents, he fights somewhat with your parents, although he has a good amount of friends and is popular.
Yeah.
Now, where would you put yourself compared to your brother? Because do you have a job?
Yeah, I do.
Okay, so you have a job, like what kind of feedback do you get from your boss?
I mean, it's okay.
Okay, so you get okay feedback. And how long have you held the job for?
Oh, about 5 years now.
Okay, so a good amount of time.
Okay.
What about where do you live? What kind of place do you have?
Got my own.
So you live in your own apartment, right?
Yeah, I do.
And you're able to keep that up, pay rent, all that stuff?
Yeah.
Okay. What about family? Do you get along with your parents okay?
Yeah. I mean, I don't live with them.
Uh-huh.
That could be
Maybe
stressful.
make things a little easier?
Yeah, a little bit.
Uh-huh.
So, yeah, so I get along.
Uh-huh. So you guys
well.
don't really fight that much?
Yeah, no.
Okay. What about friends?
Not as many as my brothers, but I got a couple good ones.
Okay. And yeah, so those friends you do have, would you say you have good relationships, that they like you, they trust you?
No? I mean, those that know me pretty much do, yeah.
Okay. So with all that information, where would you put yourself on this continuum then?
I don't know. I'm getting closer to my brother.
So
Yeah.
where'd you put yourself?
Yeah, maybe about a 40.
And that's interesting because it seems like you're putting yourself as more worthless than your brother. But with all these different factors here, your brother is unemployed, you are employed. You get decent ratings. He lives with your parents, you have your own place. He has some conflict with your parents, and it sounds like you get along really well with them. And you both have friends, he just has a little more friends. So you think that him having more friends means that he's this 20 points more worthwhile than you?
Yeah. Yeah, I think what I was doing, I was making, the friendship more important than a job.
So kind of focusing on the one
On the being more
place
popular.
that you think he's better, yeah.
Yeah.
Yeah, so with everything as a whole then, like do you think you'd be more worthwhile, still less worthwhile than your brother?
Oh, wow. Well, when you look at it that way, then I'm getting closer to him. Yeah, sure, it'd be nice to have more friends, but sure, it'd be nice. Yeah, maybe. I mean, would I put myself like equal to my brother? I mean, he's great. He's great. I mean, he's great in the friend department.
Okay. So that kind of 20% then.
Yeah, it may just even out that way.
So it's interesting that before we took a real good look at this, it seemed like you were at a 70% in terms of how worthless you are, right?
Yeah, but I mean, all I was looking at over here was, me not having the kind of social life that I want to have.
So you focus on the one thing that you.
I was focusing on what I didn't have. Yeah, but if I focus on what I do have, then my sense of worthlessness goes down, and I can feel a little bit better about myself.
I'd say that sounds good to me.
Wow. Okay, thank you.
Excellent role play. Now, Rob, how would you follow this up with a suggestion for an action plan item?
So one, if we hadn't already come up with a new core belief, I would have said something like, if you're just 20% worthless, what do you think would be a better way to describe your sense of worth? And it would have been like, I'm generally worthwhile, I have a lot of good things going for me, I just would prefer more friends, something like that. And then we could make a coping card whenever that thought comes up, or a lot of times with core beliefs you say, I feel this way. He could just remind himself of his new core belief.
So you could read the coping card.
Exactly.
Yeah. And do you want him to read it just when it comes up, or is this something that he might read every day for, a little while at least?
I would have him read it every day as well, because you want him to review this as often as possible, because it's going to show up. So if he can have this fresh in his mind, it's going to be a lot easier for him to remember how to respond. And I could also have him do something like take a picture of the coping card with his phone so he can pull it up whenever it shows up.
How about taking a picture of the cognitive continuum itself?
That's actually a great idea.
Yeah. So then he has this visual diagram to help remind him as well.
Exactly, yeah.
Thanks. Here's a reflection question for you. Have you used a cognitive continuum with clients, or a variation of it? Which beliefs did you use it for? What is important to remember about this technique? Now I'd like you to do a role play, or write a transcript in which you use the cognitive continuum technique. Now we'll talk about intellectual, emotional role plays. I've asked Norman and Rob to role play another technique, the emotional intellectual role play. In this technique, the therapist tries to find out all of the reasons, either large or small, that the client has that still seems to support the old core belief. Then instead of just evaluating each of these reasons, each of these pieces of evidence, the therapist offers an explanation. So the therapist plays the intellectual side and keeps on trying to elicit evidence that seems to support the old core belief, the emotional side.
Client is a 40-year-old man who works in corrections, coming in for depression, has a strong sense of failure as well. So you can play him as Rob, and I can introduce it this way. Rob, we could do a bit of an emotional, intellectual role play in which you play the emotional side, the part which really convinces you that you are indeed a failure. The kind of ideas, the beliefs that come to your mind that really, really bring you down. And so what we can do is you can kind of present some of those ideas right now. What comes to mind that leads you to see yourself as a failure, that leads you to bring yourself down. What I can do is to role play some ways to respond or answer those ideas.
Okay. I mean, like a big thing that stands out is just, with work, and it seems like I'm always messing up. Like a big thing was my boss yelled at me the other day for being late.
Yeah. But the boss doesn't understand. The boss is basically just working on his own agenda, and I had reasons for being late.
Yeah, but I was late because, my tire got flat, and I should have known better that, it was low. I should have changed it before that.
Fact is, I can't make any predictions like that. I've been driving on that tire quite some time without it blowing. I can't predict the future. It happened.
I'll give you that. I can't predict the future, but even with that, it seems like I can't get my life straight. Like my apartment's just an absolute mess. Like I should be able to keep it cleaner.
I made a choice to do other things rather than keep my apartment straight. But I do have the time, and I will make the plan to keep it straight in the future.
Well, but who can't keep their apartment straight? Like even if I have the time, it just seems like an adult should be able to actually keep their apartment clean.
And sometimes I'm really, really hard on myself. What happens is I didn't ask for depression. I didn't ask for depression to bring me down. And what I need to do is give myself credit for the fact that I'm doing as much as I am with depression, essentially speaking poison to my ears.
Yeah, we talked about depression before, and it does seem more difficult So, you know, I guess that makes sense. But, you know, even with that, like, it just seems like I just don't learn things well. Like the other day I was trying to use my phone and my friend was just laughing at me because he just like, he has so many apps and he does so many things with it. And like I can barely make a phone call. So that really just kind of brought it home to me.
I don't have to base my self-esteem on my friend's opinions at this point. Those are based on his attitudes, his assumptions, which have nothing to do with me.
It's like kind of a deeper down though. Like it's just my ability to learn new things. It seems like I just can't pick up things very well.
Yeah, and that deeper down maybe to depression. What happens when I see myself better, when I see my world better, when I see my future better, my attention, my concentration improves.
Yeah, I mean, that makes sense. But even with that, it seems like I'm just kind of a little bit slower than other people.
Yeah, but then when I practice, when I engage in more constructive activity, I speed up. And my motivation and my energy improves.
Well, I might not speed up, but I do eventually learn, so I'll give you that.
I thought you did a really good job. So Norman, you played the intellectual side, the side that now understands, it's a little bit later in therapy, that side that now understands that, that Rob has been looking at his experience through the lens of I'm a failure, and that that's an inaccurate way to view himself. And you did a good job of eliciting some of the arguments that Rob still has that seems to support this idea that he's a failure. And Rob, at this point, understands to some degree that he's not a failure, but he still has these small instances that happen, such as his tire going flat and his boss yelling at him, or his inability to use his cell phone as well as his friend, that still kind of day by day seem to support the idea that he's a failure. And this is kind of a shorthand method, so instead of having Rob evaluate each piece of data, looking for the evidence that it's true that he's a failure or that he's not a failure, instead you presented him with another way of viewing these situations. And it seemed to work. It seemed to be filtering down to the emotional side, that this idea that he's a failure is just not as accurate as it feels to him.
You know, a lot of time what happens when you do this with clients is kind of that experience I had as the client where they say something and you just kind of shake your head and you're like, yeah, that makes sense, and it's hard to respond. So you'll keep on going, and once you get to that point with a client, you know that, okay, you know, I've hit that point, I don't have to go any further.
The client has run out of arguments.
Exactly, yeah,
right?
yeah.
And sometimes what I've done is trade places. If the client has had a good job doing it, then I can play the negative
Oh,
thoughts.
definitely, that's what you want to do next.
And have them respond to it.
That's right, and you can use the same arguments that the client has just used, and then give the client the chance to voice aloud the responses.
And then you can beat me into submission.
There you go. Have you done intellectual emotional role plays with clients? How did they turn out? What do you think is important to remember about them? Now do a role play or write a transcript in which you use the intellectual emotional role play technique. Finally, our clinicians will discuss analogies and metaphors. How have you used metaphors to help clients change their core beliefs?
Metaphors can be a meaningful or humorous way to help communicate what could be a complicated concept to a client. And I'm working with a woman with histrionic personality disorder and depression, and she so badly wants to be seen and noticed, and yet her depression keeps her from getting out and doing things. And we were recently looking at barriers to getting out and doing things, and she said, I think I have to get myself together before I meet new people. And I thought of a metaphor I actually learned from Norman. And the metaphor goes like this. If the United States President Franklin Delano Roosevelt decided not to run for president until there was a cure for polio, he would not have been president. Yeah, and that resonated with her. She kind of took that in and was more open to making some plans to do the things she really wants to do.
So not waiting to get herself completely together.
Right, because quite frankly, none of us are ever completely together.
Anyway.
Anyway, that's right.
And there's a metaphor that I think I got from acceptance commitment therapy that I used most recently with a client who was more in the obsessive compulsive spectrum. She had the idea that she really, really need to put pressure on herself in order to get anything done. The have-tos, the shoulds, the oughts, the must-dos, not good enoughs, all those were quite present. I liken that as being the old story that there's where the gangsters take one of their buddies to some dock, slap him down on the table, and one gangster puts a gun to the doctor's head and says, you know, operate on my friend. If he dies, you die. And would you expect the surgeon would do a good job operating under such circumstances? Well, yeah. I told her that what she was doing, it was like putting a gun to her head and demanding that. She was not going to operate at her best. She was not going to perform at her best. She would not look and feel her best putting a gun to her head and making every single situation like that a do or die kind of enterprise. That really did resonate with her, seeing that the strategy that she was using, the belief that fueled that strategy of not good enough, was actually interfering with her ability to perform.
I have a client with borderline personality disorder who I would use a metaphor with, where her core belief was I'm out of control, and what made her think she's out of control was that she would get emotional, the emotion would just seem to show up all of a sudden, and then she would act impulsively. So she said, I feel just so out of control because I can't control my emotions, and then I can't control myself with my emotions. And she grew up in Canada, and the metaphor was that it's like I'm driving, and then all of a sudden I just hit an ice patch. So that the car's swerving, she's lost control of the car. So through therapy, we said, all the strategies you're learning, it's kind of like you have snow tires on now. So you get a little bit more grip. And then when you feel like you're starting to hit the ice, what you can do is you can take your foot off the gas. And what that meant for our strategies was using mindfulness. So just kind of taking a step back, observing the emotion, choosing not to act on it, and that if she can observe it without choosing to act on it, eventually the tires are going to catch again.
No, I think when we use metaphors, it hits more of the emotional level of reasoning, particularly when there's some kind of story for people to be able to envision in their mind's eye. Because when you were talking about the metaphors, for each one of them, I had a visual image. And I could see how that really sticks so much more powerfully than if we had only used intellectual techniques. What metaphors or analogies have you used? Could any of the metaphors or analogies that we just described be applicable for your clients? Here's your practice exercise. Do a role play or write a transcript in which you use an analogy or metaphor to help a client modify a core belief. There are many more beliefs that we didn't cover this week. For example, you can use the techniques in trial-based cognitive therapy to help clients modify their core beliefs. It was developed by Irismar Reis de Oliveira. It would also be helpful to look at schema therapy, developed by Jeff Young.